Hello, everyone. Thank you for joining me in this talk for World Wellness Weekend. My name is Allison Locke. I am a practitioner of traditional Chinese medicine, a fellow of the American Board of Oriental Reproductive Medicine, and a certified laser technician. My practice is at AcuBalance Wellness Center in Vancouver, British Columbia. We're a team of naturopaths and acupuncturists, and we see a great deal of fertility patients, pain and injury, mental emotional health, hormone balance, and everything in between. This specific talk will be about natural treatment options for pain management. I'm primarily going to talk about traditional Chinese medicine techniques, including acupuncture, alongside a few other modalities that I like to use here at AcuBalance. So a little bit about pain. Currently, there are 1.5 billion people worldwide suffering from chronic pain. The three most common sources of chronic pain are back pain at 29%, neck pain at 16%, and severe headache or migraine at 15%. An estimated 20.4% of U.S. adults are currently struggling with chronic pain, according to a study by the CDC in 2016. And 2/3 of people with chronic pain report difficulty sleeping, which is an incredibly important part of the healing process of the body. Lack of good quality sleep often makes pain worse and thus establishes this frustrating cycle of pain and fatigue. And what kind of effect does pain have? So chronic unrelieved pain results in longer hospital stays and rehospitalizations, decreased ability to function in day-to-day life, which can lead to lost income and create a financial burden for these patients, not to mention the emotional costs and the effect it can have on family and social life. Chronic pain can lead to painkiller dependence, higher rates of anxiety and depression, as well as a reduced quality of life. It costs about $560 billion each year in direct medical costs, lost productivity, and disability in the U.S. alone. So these are pretty significant numbers. The majority of people have suffered with pain and that needed treatment at some point in their lives. I say these numbers because it is pretty significant, and also I think it's also important to know that you're not alone in a lot of these struggles and that there are some pretty great treatment tools that can help these concerns as well. So some common treatment methods: painkillers. Drugs are often prescribed to deal with a patient's pain as a sort of first-line treatment. However, only 23% of patients with chronic pain found opiates effective, according to a 2016 survey by the American Pain Foundation, which is pretty low considering the extent of the opioid crisis afflicting North America right now. A recent review published in 2017 found that opioids at guideline recommended doses were not even effective for low back pain, which we talked about before was one of the most common pain syndromes that people struggle with. The first randomized study to ever evaluate the long-term effectiveness of opioids for pain relief found that people taking these drugs were actually in more pain at 12 months compared to those who were on non-opioid-based pain relief methods. So what about NSAIDs? So NSAIDs, or non-steroidal anti-inflammatories like ibuprofen, Advil, naproxen. A recent study of 440,000 patients found that using any NSAID, including over-the-counter drugs like ibuprofen, for even a short period of time was associated with an increased risk of acute heart attack, even in healthy, low-risk people. And they can also cause a lot of pretty nasty gastrointestinal concerns, so they're not very friendly long-term. On a side note, if you're interested in some of the clinical research and scientific evidence about acupuncture and pain, I highly recommend checking out evidence-based acupuncture. You can find them on evidencebasedacupuncture.org. They have a lot of great information about chronic pain and treating it as well. So that brings us to acupuncture. So a little bit of a background about acupuncture. It has a recorded history of about 2,000 years. Traditional Chinese medicine, or TCM for short, is a systemized version of the many different theories of Chinese medicine since the Cultural Revolution in China, which occurred in the mid-1900s. So traditional Chinese medicine consists of a variety of modalities, including acupuncture, Chinese herbal therapy, Gua Sha, which we'll talk a little bit about later, cupping, Tuina massage, nutritional therapy, moxibustion, acupressure, and Tai Chi and Qigong exercises. So there's tons of different things that can be effective for a bunch of different conditions. The actual practice of acupuncture consists of placing very thin, sterile, disposable stainless steel needles into various spots in the body in order to stimulate a physiological response. So acupuncturists are trained in these extensive pathways of various organ systems along with their anatomical location and physiological function of hundreds of different points along those channels. So based on your syndrome, these different points are used to stimulate specific channels to achieve a desired result. So acupuncture helps activate the parasympathetic nervous system, which is the healing state of the nervous system as opposed to the fight or flight response. It increases blood flow to injured areas and also sends a message to the brain to release pain-relieving, kind of feel-good neurotransmitters such as endorphins and serotonin. It also boosts the immune system, decreases inflammation, and instills homeostasis in the body. So there are dozens of conditions that the World Health Organization has deemed effectively treated by acupuncture through controlled clinical case trials. A host of neurological, musculoskeletal, respiratory, or digestive concerns, ranging from depression to adverse reactions to chemotherapy to hypertension. But for the sake of this presentation, I'll stick to specifically the pain syndromes. So the diseases, symptoms, or conditions that acupuncture has been proved through controlled clinical trials to be an effective treatment include neck pain, low back pain, dysmenorrhea or period pain, facial pain, gastritis, headache, knee pain, neck pain, shoulder pain, temporomandibular joint dysfunction or TMJ, rheumatoid arthritis, sciatica, sprains, and tennis elbow. And there are tons of other conditions where acupuncture has been shown to have a therapeutic effect, such as abdominal pain, ear pain, fibromyalgia, post-herpetic neuralgia, spinal pain, and tons of other conditions that would take way too long to list. How does it work? So acupuncture is widely known for its effectiveness in the treatment of pain. It's kind of one of the reasons why and how it's become so popular around the world. It's also been pretty widely studied. The largest study evaluating chronic pain and acupuncture found marked or moderate effectiveness in 76% of the cases that they looked at. A 2-year retroactive study that was published in 2016 found that 93% of patients said that their acupuncturist was successful in treating their musculoskeletal pain. And there's tons of other clinical case studies available if you're interested in finding anything more than evidence-based acupuncturist. So acupuncture works with a few different areas of the body. It deactivates pain centers in the brain. So the acupuncture needles aren't directly penetrating the nerves in the body. However, they are stimulating some of the distal nerve fibers and neural pathways through the central nervous system to the parts of the brain that are responsible for the deactivation of pain. It also activates the body's own opioids. So acupuncture has been demonstrated to activate a number of the body's own opioids as well as improve the brain's sensitivity to them. And so this is a great sort of treatment for pain management. And there's a ton of other biochemical reactions that occur for pain that is involved in this pain reduction technique that is released or regulated by acupuncture, and that includes ATP, adenosine, GABA, and substance P. A lot of these are anti-inflammatory markers and neurotransmitters, endorphins, and serotonin. Acupuncture also activates the parasympathetic nervous system. So the parasympathetic nervous system is the opposite of the sympathetic or fight or flight response of the autonomic nervous system. So acupuncture helps induce this relaxed state in the body by activating this aspect of the nervous system, because when you have a lot of chronic or acute pain, this stimulates the sympathetic nervous system, which then decreases the blood flow to the injured site. And you'll see that increasing blood flow is a crucial mechanism for treating pain, because it's basically how the healing process works. It's how your immune system gets to the injured area so it can heal it. So yeah, that's another thing that I'll mention quite a few times in this webinar. So it's how your immune system gets to the damaged tissue in order to clean up the mess, the cellular debris, and ultimately heals and regenerates the tissue, be it a muscle, a joint, a ligament, a tendon. Some frequently asked questions about acupuncture. The top one is definitely, does it hurt? So acupuncture is not meant to be painful in any way. Sometimes you feel a slight prick upon insertion, and then sometimes you feel a dull ache or tingling or warmness or soreness, kind of a heaviness sensation with the needle placement. However, no part of the treatment is ever meant to be painful or uncomfortable right away. Usually that little dull ache immediately dissipates and you're able to relax for the rest of the treatment. So the whole point is for it to be very comfortable. Are there any risks or side effects? Acupuncture is an incredibly safe treatment modality with minimal risk of adverse side effects. Usually there can be slight bleeding or small bruises. However, it doesn't happen very often, and each needle is sterile and disposable, which eliminates the risk of infection. How often will I need treatments, and when will I start to experience results? So frequency of acupuncture treatments may be determined by the severity of the condition, whether it is chronic or acute, and a variety of other factors that will be determined during your initial consultation. Typical treatment is usually once or twice weekly, with regular reassessment of the symptoms and appropriate modification of the treatment protocol if needed. And when will I start to experience results? Everybody's body responds very differently to acupuncture, so it's difficult to tell before treating you what will happen. It might take a couple treatments for you to notice some results. Most people feel really calm and really relaxed after acupuncture, and so the improvement of the conditions will really vary depending on the severity and the duration. How does it work? Acupuncture consists of inserting hair-thin stainless steel needles into various parts of the body to elicit various biological and physiological responses through activation of sensory receptors. So it activates this parasympathetic nervous system, which is the healing state of the autonomic nervous system, increases blood flow to injured areas, which, as we talked about before, was really important to heal the injured area. It decreases inflammation and also boosts the immune system. And then it also sends the message to the brain via the central nervous system to release these pain-relieving neurotransmitters. What if I'm afraid of needles? So most people aren't the biggest fan of needles, understandably. However, acupuncture needles are significantly thinner than any hypodermic needle that you might be used to. So acupuncture causes very little to no discomfort at all and is well tolerated by most people. So during your initial consultation, we will go, if we have a treatment that day, we go at a pace that's comfortable for you. I always walk my initial patients through the first few points so they know what to expect. And if anything's uncomfortable at all, I can remove the needle. It's absolutely fine. And if needles aren't for you at all, then we have a variety of other treatment modalities that we can try, such as cold laser, Gua Sha, moxa, acutonics, cupping, diet and lifestyle changes, supplementation, or Chinese herbal therapy. Electrostimulation, or e-stim, is a tool that I use often in my practice. So in this technique, little wires are attached to the handle of the needle, and a mild electrical current is delivered through them to sort of further stimulate the acupuncture point. So these little machines really help me get the most out of the acupuncture point and delivers this sort of certain particular frequency that the nervous system can respond to in a positive way. It's not uncomfortable or painful at all. It does sound a little bit scary at first, but I only turn up the stimulation to a point that's comfortable for my patients. So there's these specific frequencies that then pass through these wires, and it goes along sort of the central nervous system to then stimulate various parts of the brain. So then it helps the brain release these pain-relieving neurotransmitters and endorphins, oxytocin, and dopamine, which can really help with pain management. So I also have training in a unique acupuncture and e-stem technique called neuropuncture, which was developed by Dr. Michael Corradino, which combines neuroscience and acupuncture for pain management and a variety of other orthopedic and internal medicine syndromes. Neuropuncture uses the traditional TCM model along with a few slightly different acupuncture points of its own that specifically follow nerve pathways in the body, and it targets these specific receptors in the brain that then release these specific neurotransmitters, resets dysfunctional pain signals that the brain is sending out, and decreases the inflammation of these overstimulated nerve roots for pain management. And I find it to be a very effective method of acupuncture. So let's go over a couple case studies. The first one, acute back strain for 1 week. So one of my favorite things is when patients are able to get in right away for a treatment. I had one patient, a 55-year-old male, who came in for treatment after a hockey game where he took a really awkward fall and strained his back. He took care of it during the hockey game, didn't think too much of it, but then the next day he woke up and his back was extremely sore and the pain was starting to radiate down his left hip that he felt pretty severely when he was sitting up and down. So I did some points on his lower back and around his spine, and then I also did some trigger points in the muscle to help release the soreness, and then I also did some points down the leg that attached to the nerve root that his pain was following. I also added some e-stim, and his pain went from a 9 out of 10 to a 5 out of 10 after the very first treatment. And then after the fourth treatment, it was almost entirely better with just one little sore spot on his back. And then he was completely fine and discharged after the fifth treatment and was back to playing hockey in no time. The second case study that I have, this patient came to me with tennis elbow in her left arm that she was suffering with for about 6 months. And she felt this deep ache with overuse of her arm, and there was this one specific spot on her forearm that was incredibly tender to touch. She was trying physio and IMS, and they weren't improving it much at all. So I did some neuropuncture points on her arm and attached it to some e-stim. And hers was actually one of those incredible cases where it was completely gone after the very first treatment. When she came back for her follow-up, we definitely continued to do some maintenance. And then she also wanted help with other areas of her body that she had some chronic pain with it as well. So she had some left foot pain and right ankle pain, which we also treated, and it was effective as well. I definitely want to make a point that not every condition responds immediately to acupuncture. It's always great when you have that case where a patient comes in with acute pain and you're able to treat it in a couple treatments. That's always great. But yeah, so not every condition responds immediately to acupuncture. Sometimes it takes a few treatments in order to notice a lot of the results, and that's also fine too. It does not indicate that you aren't a good candidate for acupuncture. You definitely still are. I just find that sometimes more chronic or more severe conditions take maybe a few more treatments than something that's more acute or maybe more mild. Cold laser. So laser therapy is a treatment technique that I use quite a lot in my practice. And it uses red and infrared light to stimulate the body's own natural healing process. So this light is a specific wavelength that the body can respond to. And with placement on an injured body part, your cells absorb these photons, which then stimulates ATP production in the mitochondria of your cells, which your body is then able to translate into cellular energy. So then the cellular energy is then able to repair, regenerate, and heal damaged tissue and speed up the healing process. Some other functions of cold laser is that it improves blood circulation through vasodilation, meaning it makes your veins expand a little bit so more blood can go through to the injured area. It relaxes the muscles and promotes a process called angiogenesis, meaning it helps your body repair and create new blood vessels and capillaries so your immune system can get to the site of injury to heal it. It also breaks down the cycle of chronic inflammation by decreasing pro-inflammatory cytokines and increasing anti-inflammatory cytokines, and it also lowers oxidative stress. Oxidative stress means there's too many free radicals that are causing inflammation and tissue damage. So laser therapy also increases the release of pain-relieving neurotransmitters similar to acupuncture. And all of these mechanisms combined make it a really effective tool for treating both acute and chronic pain because it enhances the body's immune response and it naturally speeds up the healing process. So some laser frequently asked questions. One of the most common questions I get when people come in for an initial consultation is, how is laser different than acupuncture? So laser therapy and acupuncture, they share a lot of benefits, such as increase in blood circulation, decrease in inflammation and pain relief through anti-inflammatory cytokine and neurotransmitter secretion. But instead of using acupuncture needles, those stainless steel needles, to activate the nervous system, it uses red and infrared light to stimulate the cellular photon metabolism. And one of my favorite things is actually to combine both laser and acupuncture in these treatments because I can frequently do them both at the same time. And I think it's great because then you combine sort of the best of ancient Eastern along with these innovative Western modalities for these powerful multidimensional treatments. So during your initial consult, we'll kind of discuss whether laser, acupuncture, or both will be best for your specific health concerns. How often will I need treatment and when will I start to notice results? So with low-level laser therapy, initial frequency is vital for these effective results. So depending on the condition, we typically recommend 2 to 3 treatments per week for the first 2 weeks or so. And then once we start getting some results, we can gradually taper down until only periodic maintenance or complete alleviation of symptoms is achieved. Generally, 5 to 20 treatments are the typical amount before complete desired results are achieved, but it also depends on the severity, the type, and the length of the injury. So some people respond to the laser right away and they notice a little bit of results after the very first treatment, which is great. And then some people, it takes a few treatments. So usually by the 4th or 5th treatment, you should notice a result. And if not, then there's a lot we can do. We can increase the intensity of the laser. I can change the dosage a bit of the power, which can make it a bit more effective. And the difference between acute and chronic injuries. So basically, the sooner that you treat an injury, the better. And typically, acute injuries heal faster than chronic ones. Chronic injuries usually require a bit more treatment than acute injuries, but it also depends on how your body responds to both the acupuncture and the laser. Some people respond really great and really fast, and then some people are a bit slower, but we still eventually get the results that we'd like. And are there any side effects of laser therapy? Laser therapy is completely safe. It is pain-free. You don't feel anything when the laser is on your body because it's called cold laser because it's non-thermogenic wavelength of light. And it's non-invasive. So a few case studies about laser therapy. One patient I treated was suffering immensely with rheumatoid arthritis for about 4 years. And she had this terrible knee pain, wrist pain, and ankle pain. And so within the first 2 weeks of treatment, she began to notice an improvement, which is how I knew that laser would be a good treatment tool for her. And so after those 2 weeks of treatment, I believe she got about 4 to 5 treatments in those 2 weeks. There wasn't that 10 out of 10 sharp pain when she stood up from the couch or walked up the stairs. So after 5 weeks, she went from taking 8 painkillers a day to 1 or 2, with her worst pain ever creeping up to about a 5 out of 10. And at this point, she was actually getting such great results that she actually bought the same exact laser system that we were using for her treatments to continue at home. And I checked in with her about a year later, and she was doing wonderfully. She was still lasering various joints pretty infrequently, kind of at this maintenance level. And her worst pain was a 2 out of 10 maximum. Her swelling was down. Her range of motion increased by what she said, she called it 200%. So yeah, laser really worked out for her in that case. I had another patient that had acute shoulder pain for about 1 month, and that was a result of a sports injury. He had a pretty rough tumble while surfing and felt this sort of tearing pain in his right shoulder. And after every time he lifted up his arm, he would feel that sharp pain in that exact same spot. And so this injury was about a month old, pretty acute. And it was completely resolved after two laser treatments that were a few days apart. There was another patient that I treated from Toronto that was in town in Vancouver for a few days and heard about our clinic and wanted to give laser a try. She was suffering from this really terrible low back pain due to a spinal disc herniation. So her lower back constantly throbbed, and she had this like sharp pins and needles pain that would radiate down her left leg. And she even had back surgery scheduled for later that month. So we did 2 laser treatments on her lower back. I believe I also did some acupuncture as well. And a couple weeks later, I heard from her that she experienced several days of pain relief and increased range of motion in her back after those treatments. And then she continued treatment in Toronto and was actually able to cancel her back surgery entirely because she no longer had that numbness in her toes, and she had significantly less discomfort in her low back that was radiating down that leg. I've also had success using laser to treat one of my patient's rotator cuff tears. So one tear was measuring at 1 centimeter, and the other tear was at about 0.8. And so she was experiencing pain in her shoulder for over 2 years, with it getting progressively worse. It was constantly achy, and then she would feel that sharp, intense pain whenever she reached behind her in the back seat when she was in her car. So she booked 5 treatments over a span of 2 weeks, which was great. That was our typical 2 to 3 treatments a week that we really like to see right off the bat. And she noticed a decrease in pain after the 3rd treatment. She was then able to move her shoulder in ways that previously caused that excruciating pain. So she continued twice a week for a few more weeks, and then the pain decreased to such a point that we were able to start tapering them off. And then we're just in the maintenance stage of her treatment protocol, with the pain decreasing a bit more each session. I also had a 67-year-old woman who came to me after an outbreak of shingles that covered the right side of her hip and flank. So the blisters had healed, but she was dealing with this excruciating, sharp nerve pain that was triggered even by the brush of the clothing on her back. And after her very first treatment, she noticed a reduction in the pain. So we had her follow our typical twice per week laser protocol, and we noticed improved results after each treatment. And then by the 4th treatment, the lesions were dramatically reduced, and the light touches to her side were a lot more bearable. And then by the 7th treatment, the lesions were nearly non-existent, and there was only a very, very small part of her back that was still sensitive. And after a couple more treatments, she was completely free of pain. Gua Sha is another technique that I like to use often for pain management in my practice. It's similar to cupping. If you've ever heard of that, there's quite a few celebrities that have been photographed with those sort of trademark circular bruises on their back, usually their skin on their back. Like Michael Phelps, Jennifer Aniston, even Justin Bieber, they've been photographed with these sort of cupping marks on the body. Gua Sha is similar to cupping in that it's a physical technique used to break up stagnation in the muscle. And it also results in these very apparent marks on the skin. But for Gua Sha, we used a dull-edged object and we gently scrape oiled skin sort of in a downward motion. And what it does is it breaks up the stagnant blood in the muscle tissue, and it helps resolve spasms in the muscles and pain. It increases blood flow, reduces inflammation, and also helps break up the lactic acid in the muscles that sort of results in that sort of stiff feeling. So usually right after the treatment, patients experience immediate changes in the stiffness and pain with increased mobility. And research has shown that Gua Sha causes a 4-fold increase in the microcirculation of surface tissue, which is important. We talked about before that blood circulation is crucial for the healing process to occur. So Gua Sha is really awesome at helping improve that blood flow to those injured areas to help heal the site of injury. And I find Gua Sha to be an incredibly effective treatment tool for tight shoulders and back muscles, and also tension headaches that are usually a result of these really tight muscles sort of in the back of your neck and down your shoulders. So it's not a painful technique at all, and these marks typically fade within 3 to 5 days, similar to cupping. I had a patient come in I was treating for frozen shoulder. He had 6 months already of pretty bad shoulder pain and extremely limited range of motion. He could barely lift his shoulder at all. We began a series of laser and acupuncture treatments at twice per week, but we were getting extremely slow results. It was only after the 11th treatment that we were starting to get some results. So I decided to add Gua Sha to his treatment plan. And after that, he definitely started to notice improvement week by week. After treatment number 15, his range of motion was loads better, and the pain was decreasing and almost non-existent by treatment number 22. And I think this case is pretty interesting because it took quite a while for us to get results. And he had about 2.5 months of treatment before we got those good results. But if you know anything about frozen shoulder, it can actually take up to 2 to 3 years before the pain resolves and your range of motion returns, even with regular physiotherapy and current treatment tools that people use for frozen shoulder. So in the grand scheme of things, 2 to 3 months of treatment is nothing compared to 2 to 3 years of struggling with frozen shoulder. So I found Gua Sha to be really helpful in turning this case around and really helping to get those effects. And that concludes my presentation. Thank you very much for joining in on this today. Again, my practice is at AccuBalance Wellness Center. We have our phone number here, our email, our website. We have online booking for initial consultations, and we also have complimentary 15-minute phone consultations with any of our acupuncturists or naturopaths. I think they're a great tool. We schedule those calls after you filled out some forms, so we kind of know what exactly we're going to be talking about or addressing in future treatments. And then it's a great opportunity for you to ask any questions that you might have. What might your treatment protocol look like?